So, it's diabetes then? Just say it straight, doctor.
It is, and I'd rather tell you plainly than dance around it. Let's go through exactly what that means for you and what happens next. Hello and welcome to Medical Voices. I'm Nadia.
And I'm Tom.
We're here to help you learn the language of medicine, not to give medical advice.
Today, a new diabetes diagnosis in a GP results appointment after blood tests. Let's get straight into it. I'll be Graham, and Nadia will be Dr. Khan.
And stay to the very end. There's one line Dr. Khan uses that flips how the whole conversation feels.
Let's go.
Mr. Pearce, come in, take a seat. Thank you for coming back in for your results.
Morning, doctor. Right, let's hear it. I've been chewing on this since Tuesday.
I can imagine. Before we start, are you all right for time today? I don't want to rush this.
I've got an hour before I need to be back on site. That's plenty.
Good. I've got your blood test results back, and I'd rather just tell you plainly than work up to it.
So, it's diabetes then? Just say it straight, doctor.
It is, and I'd rather tell you plainly than dance around it. Let's go through exactly what that means for you and what happens next. Your blood sugar has come back in the diabetic range. This is type 2 diabetes.
Right, okay. I mean, I half expected it. My dad had it. But hearing it out loud is different.
It is, and I'm not going to pretend it isn't a big word, but I want you to know exactly what it means in practice, because it's a lot more manageable than most people think when they first hear it.
Go on then.
We ran 2 tests. The first is called a fasting glucose. That's a snapshot of your blood sugar taken first thing in the morning before you've eaten. The second is called an HbA1c. Think of that one as a kind of long-term average, not a snapshot of today, but a picture of where your blood sugar has been sitting over the last 2 to 3 months.
And both came back high?
Both came back above the normal range, yes. That's what confirms the diagnosis. The important thing is that we've caught it, and we've caught it early enough to do something about it.
Is this because I'm overweight? Because I know I've put on a couple of stone.
Weight is one factor, and it's an honest question. But it's not the whole picture. Your age, your family history, your dad having it, those play a part too. This isn't about blame, it's about what we do next.
Right, so do I need to go on tablets?
Not today. We always start with lifestyle first, and that's what I'd like to talk through with you now. We'll see how you get on over the next 3 months, and then we'll check your blood sugar again. If we needed to add a medication to help lower your blood sugar at that point, we'd talk about it together. But right now, the plan is lifestyle changes, and I think you'd be surprised how far those go.
Lifestyle changes? You mean diet and exercise?
Diet and activity, yes, but not the way most people imagine. I'm not going to hand you a list of things you can't eat. Tell me about a typical workday first. What does your day actually look like?
I'm a builder, so I'm up at 5:30, on site by 7, on my feet all day. I'll have a bacon roll and a tea when I get there, sandwich at lunch, then whatever my wife puts in front of me for dinner, couple of biscuits before bed, maybe a fizzy drink or 2 during the day.
Right, so the good news is you're already on your feet most of the day. That's physical activity that a lot of patients have to build from scratch, and you've already got it.
So I don't need to start going to the gym?
Not unless you want to. What I'd suggest is building on what you already do rather than starting from zero. Maybe a walk on the days you're not on site, or taking the stairs instead of the lift when you can. Small things that fit around your life.
And the food?
The biggest thing with blood sugar is carbohydrates. That's your bread, pasta, rice, potatoes, and sugary drinks. I'm not going to ask you to cut them all out, but swapping 1 or 2 things makes a real difference. More vegetables on the plate, fewer sugary drinks, most days of the week. Not every day, most days. And it's about what works for you and your wife, not a plan I hand you that doesn't fit your actual life.
That sounds more reasonable than what I was expecting, honestly.
Good, because the plan only works if it fits around the life you're actually living. Now, the other thing I want to explain is what happens from here in terms of regular checks. Once a year, we'll do what's called an annual review. It has 3 parts. First, a blood sugar recheck so we can see how the HbA1c is tracking. Second, a diabetic eye check. That's a screening for changes to the blood vessels at the back of your eye. Diabetes can affect those over time, and we check early so we can act early if anything changes. Third, a diabetic foot check. We check the feet because diabetes can affect the nerves and circulation there, often before a patient notices anything. It's a 5-minute check, nothing more. Med nomads. If you work in primary care, how do you introduce the annual diabetes review to a patient who's just had the news? Drop your go-to opening line below.
And that eye thing and the foot thing, those happen once a year?
Once a year, the eye check is done by a separate team and we'll send you a letter with the appointment. The foot check we do here, and the blood sugar recheck, that's with me at your annual review.
So, I've got a plan. Diet, stay active, and come back in 3 months.
That's it. And let's book that 3-month follow-up before you leave today, so it's in the diary. If anything comes up before then, or you have questions, or you just want to check something, call the surgery. You don't need to wait for the appointment.
I thought you were going to tell me my life was about to change completely.
Parts of it will change, but this is something you'll manage, not something that manages you. And you're not doing it alone. That's what the plan is for.
Thank you, Doctor. I feel better than I did when I walked in.
That's exactly what this appointment is for. Now let's do 3 key exchanges again, a little more slowly.
So, it's diabetes then? Just say it straight, Doctor.
It is, and I'd rather tell you plainly than dance around it. Let's go through exactly what that means for you and what happens next. The first is called a fasting glucose. That's a snapshot of your blood sugar taken first thing in the morning before you've eaten. The second is called an HbA1c. Think of that one as a kind of long-term average, not a snapshot of today, but a picture of where your blood sugar has been sitting over the last 2 to 3 months. Parts of it will change, but this is something you'll manage, not something that manages you. And you're not doing it alone. That's what the plan is for.
Let's go back and decode the language you just heard. 10 terms from that consultation. Term, definition, 1 example.
Pause and repeat whenever you want to.
Term 1. Type 2 diabetes. A long-term condition in which the body doesn't use insulin properly, leading to raised blood sugar over time. You heard the GP confirm it directly, without hedging. This is type 2 diabetes. Example. The blood tests have confirmed a diagnosis of type 2 diabetes.
Term 2. Blood sugar. The everyday, patient-facing term for glucose levels in the blood. The GP used blood sugar throughout with the patient, keeping it in plain language. Example. Your blood sugar has come back above the normal range.
Term 3. HbA1c. HbA1c. A blood test that shows the average blood sugar level over roughly the last 2 to 3 months. The GP described it as a kind of long-term average, not a snapshot of today. Example. We'll recheck your HbA1c at your 3-month follow-up.
Term 4. Fasting glucose. A blood sugar reading taken first thing in the morning after not eating for several hours. The GP contrasted it with HbA1c as a snapshot versus a long-term average. Example. The fasting glucose was taken before you'd eaten anything that morning.
Term 5. lifestyle changes. The GP's umbrella term for the non-drug approach to managing type 2 diabetes: diet, activity, and weight. Framed collaboratively, not as a lecture. Example: we always start with lifestyle changes before considering medication.
Term 6. Carbohydrates. Carbohydrates. The nutrient group most directly linked to blood sugar rises. Bread, pasta, rice, potatoes, sugary drinks. The GP kept it at general advice level. More vegetables, fewer sugary drinks. Example: reducing refined carbohydrates can help manage blood sugar levels.
Term 7. Physical activity. General movement and exercise. The GP tailored this to the patient's working life rather than prescribing a gym routine. You're already on your feet most of the day. Example: even moderate physical activity most days of the week makes a difference.
Term 8. Diabetic eye check. An annual screening for changes to the blood vessels at the back of the eye caused by raised blood sugar over time. Part of the yearly review, not an urgent concern. Example: you'll receive a letter inviting you for your diabetic eye check.
Term 9. Diabetic foot check. An annual check of circulation and sensation in the feet. The GP explained it practically. Diabetes can affect the nerves and circulation there, often before a patient notices anything. Example: the diabetic foot check takes about 5 minutes at the surgery.
Term 10. Annual review. The yearly GP appointment that brings the blood sugar recheck, the eye check, and the foot check together. It gives the patient a concrete structure: what happens, when, and with whom. Example: your annual review is the appointment where we check everything together.
5 things to take away from that consultation. Point 1. Confirm before you comfort. Listen to how the GP handled the diagnosis. She stated it plainly in one sentence: this is type 2 diabetes. No hedging, no softening, no slow build-up. She named the news clearly first and only then moved to reassurance. That order matters. Softening the news before naming it reads as evasive, not kind. Naming it first, then immediately offering a plan, is what OET Speaking's providing structure criterion rewards. And, as we said at the start, this is exactly the kind of exchange OET Speaking scores directly on both the providing structure and relationship-building criteria. That goes for IELTS healthcare speaking too.
Point 2. Explaining a number without saying the number. HbA1c and fasting glucose were explained entirely through metaphor. A long-term average versus a snapshot taken first thing. No figure was voiced. That's deliberate. This is lifestyle medicine register at its best, making a complex test result meaningful to a patient without turning the consultation into a maths lesson. If you're preparing for an exam, notice that the clarity came from the framing, not from the precision.
Point 3. Ask before you advise. The GP asked about the patient's workday before suggesting any lifestyle change. Tell me about a typical workday first. That one question turned a generic list of do's and don'ts into a plan built around what the patient already does. He's a builder. He's already on his feet all day. So the advice started there, not with a gym membership. A plan built on the patient's actual routine rather than a printed handout is the OET relationship building criterion in action.
Point 4. Routine before restriction. The annual review, the eye check, the foot check, the 3-month follow-up. Those give the patient a structure to hold on to, And that structure does more for adherence than any single piece of dietary advice. When a patient leaves with a plan that has dates and appointments, rather than just a list of things to avoid, they're more likely to come back. Quick note for those of you working in different systems: diabetes screening and annual review structures are broadly similar across the UK, Australia, and Canada. In the US, the system often routes patients to a diabetes educator for the lifestyle planning conversation you heard in this episode. The vocabulary is the same. The pathway is what changes.
Point 5. Something you'll manage, not something that manages you. That closing line is worth learning on its own. It reframes a chronic diagnosis from something that happens to the patient into something the patient can control. The whole consultation builds to that shift: plain diagnosis, no blame, collaborative plan, concrete dates, and then that single line at the end that hands agency back. If you take one phrase from this episode into your next exam or your next clinic, that's the one. 5 points. That's the breakdown. Now it is quiz time, Nadia.
That's right. 3 questions. Tom, ready?
Ready?
Question 1. What's the difference between HbA1c and fasting glucose? In the plain English terms Dr. Khan used. 5 seconds. Think before you listen.
HbA1c is a long-term average. It shows where the blood sugar has been sitting over the last 2 to 3 months. Fasting glucose is a snapshot taken first thing in the morning before eating. One looks back over weeks, the other looks at right now. The GP used those exact metaphors to explain both tests without quoting a single number.
Question 2. Name the 2 annual checks that are part of the diabetes review beyond the blood sugar recheck. 5 seconds.
The diabetic eye check and the diabetic foot check. The eye check screens for changes to the blood vessels at the back of the eye. The foot check looks at circulation and sensation, because diabetes can affect both before a patient notices anything. Together with the blood sugar recheck, those 3 make up the annual review.
Question 3. What does lifestyle changes mean in this context? And why did Dr. Khan ask about Mr. Pearce's workday before suggesting any? 5 seconds.
Lifestyle changes means the non-drug approach: diet, activity, and weight. The GP asked about his workday first because he's a builder, already on his feet all day. That meant the physical activity advice could build on what he already does, instead of starting from scratch. The plan fits the patient's real life. That's the whole point.
3 questions, 3 clear answers. The PDF transcript has all 10 vocabulary terms, the full dialogue, and the language notes. Link in the description.
That's episode 13. Graham's got a plan that actually fits his life, and a date on the calendar for his next review. Next week, a very different kind of care. Mrs. Davis is back for a wound dressing change, and this time it's the nurse in charge. See you next week, Med Nomads.
See you next week.